care subspecialty with yourselves here at Chris Hani Baragwanath. I had a few discussions with Dr. Brown, making sure that we are paving the way for that, but then politics came in, and the call to serve the nation and to serve the people of South Africa in a different capacity, I had to accede to. I also saw Prof. Tsitsi also gave us a good opportunity when I was a medical student to spend the time in the medical wards. When I was doing 5th year and 4th year, my festive season or my festive holidays, I used to spend them here at Chris Hani Baragwanath, because I was not very attentive student, so I needed extra time to do other things to consolidate my skills. We are faced with a very difficult mammoth task of fighting the pandemic, which is described as an invisible enemy. But this is one of the tasks that as humanity we have to achieve, and we have to unite and work with strength to make sure that we defeat the pandemic. The virus that we are facing is one of those viruses that it is predicted that in future we are going to be getting waves and waves of such pandemics going forward. So this is one of our tests as a world to make sure that we are prepared and we are ready for the next coming wave. The issues that relate to climate change become very real, because some of the pandemics and epidemics will be actually related to climate change. So in essence, what I'm trying to say is that COVID-19 is actually trying to make us, in a bigger scheme of things, mainstream what we call sustainable development goals, to make sure that when we deal with issues of health, we don't only deal with patients as they enter the hospital or as they enter the clinic, but we deal with them as they are, where they are as citizens. When we started our fight, we made sure that we are almost ready, but like when you are a student preparing for exams, you don't get fully ready until after the exams, and you then in retrospect able to say that yes, indeed I was ready. But it's something that we are going to try and do, and always try and unite and make sure that we defeat the pandemic. This donation comes very handy to us. I think we love presents, we love donations, and we'll hold you to it, Madam Ambassador, that it's not going to be the last one that we get. For all other facilities that we have, we'll need to have more of that. Indeed, we have good clinicians here. We did say in the beginning of the pandemic that we are looking at a different pathological work that we are seeing with the virus progress. And we also said that ventilation might not be the first line of treatment, but it becomes one of our lines when we really need to be actually dealing with a very critical and a very unstable patient. When we started our term of office, we felt that it's important that we create a department that is patient-centered, meaning that everything that we say and do and plan should be about patients. And we also made an undertaking that clinicians will be leading the department. So clinicians, in the respect of doctors, in respect of nurses, physiotherapists, they must decide what should happen to patients. It shouldn't be politicians who make such decisions. The role of politicians like ourselves here is just to create a proper, conducive platform and environment for our clinicians to be able to serve and save life. We also made an undertaking that we are going to build a department that is stakeholder-driven, meaning that we are all about partnerships, we are all about solidarity, and we are all about alliances. So this donation comes within that space that our stakeholders will play a role in making sure that we create a system that is patient-centered and that we actually want to build. As I finish my welcoming remarks and as I welcome you, I would like us to rise and observe our frontline workers who have lost their lives to this pandemic. At Chris Hani Baragwanath last week, we lost one of the nurses that I used to work with in one of the I think it's one of the only infectious obstetric unit in the country, because we have a ward 57, which is an infectious ward, where we keep all our patients who are very sick with TB, MDR, and also who've got sepsis post-delivery. So this Sister Winnie, is one of the nurses who, in actual fact, demised of the COVID. He's actually spent almost 3 weeks in hospital in ICU, and would like to observe not only her, but all the nurses, all the doctors, international and in the country, who have actually made sure that they are able to fight the disease and demise of it. So can I just request that we observe that moment of silence? The sisters will come and light the candles. I didn't recognize you with the mask. In memory of all our frontline workers, our heroes, people who sacrifice their lives to serve the nation, to serve our people, who leave their families behind, and who come and make sure that they, in actual fact, sacrifice their lives and give it all in the service of our people. I think in this level we can say, can their soul rest in power. Thank you. Thank you for your indulgence. It's really important for us to acknowledge the importance of our healthcare workers. And it's important as a department, as a government, that we put everything in our resources to make sure that we facilitate their work and make them sure that they are easy and they work without anxiety and without fear when they face this pandemic. These are our unsung heroes, these are our unsung heroines. And in the year of the nurse and in the year of the midwife, we'd like to say that we shall overcome and defeat the pandemic. Feel welcome. This is the mecca of the South African healthcare system in South Africa. It's the biggest hospital. Our labor ward, as Prof. Mkhize said in the briefing, that it delivers over 30,000 babies per annum, and this is a great feat. Even in the line of COVID-19, we have delivered 12 babies already to positive mothers, and all were delivered by cesarean section. And in the 12, only one baby was found to be positive, which it's also known that it's not vertically transmitted, but I think it's just something that happened in the world. But we are proud of the work that our staff are doing in the critical unit, in our internal medicine unit, also in our obstetric unit. We just feel that we should have made more stringent regulations on alcohol, because our trauma unit has started to be very active for the past week. But I think feel welcome. You are home here anytime. If you want to make a turn, you can come here. In actual fact, there is an airstrip in the hospital. So if you can come and land this side, we can be able to actually to accommodate you, because this was a military hospital, as it was built. So it has an airstrip which can land small planes. Thank you. Feel welcome.
Thank you very much, Dr. Bandile Masuku, for the very, very warm welcome. And thank you very much to give those words of courage to colleagues who are on the front, our nursing sisters, our doctors. It's very challenging on the ground, so those words of encouragement goes a long way. I'll want to okay. Thank you. As we move on, I want to acknowledge, I saw Prof. Yasmin Jina around. She is our chairperson of the Internal Medical Advisory Committee, MEC, so to say. Colleagues and ladies and gentlemen, I'm going to make few changes from the program to avoid disruption. So the next item that was supposed to be a viewing of the demonstration in a way of showing how good the ventilators do, I'm going to move that item to the end as suggested, so that we don't have to go and come back and settle down. I just want to further add that for those who will need the ablution area, we go that side and the arrows will show and guide us appropriately. This partnership for us as Bara, it comes very handy as we have just committed about 321 beds just to COVID. 221 beds just for COVID. So we are, in a sense, very much ready in that preparation. But like the MEC said, then other aspects of support are always needed to consolidate that. So Ambassador Max, this gesture is very, very much remarkable to us in terms of doing service delivery to the patients that are affected. On that note, I'm going to ask Ambassador Max to come and give remarks on behalf of the United States of America, who donated this remarkable gift to the health keeping and promotion of South Africa.
Good morning, Minister Mkhize, Deputy Minister Phaahla, Premier of the Gauteng Province, Mr. David Makhura, MEC for Health, Dr Masuku, Professor Mativa, staff from the Chris Hani Baragwanath Hospital.
You can take off your mask so that
okay, can I?
Because they do some interpret sign language, so it helps.
Thank you. Coming from the Minister, that's very good direction. I will obey. Thank you, sorry. So, good morning, Minister Mkhize, Deputy Minister Phaahla, Premier of the Gauteng Province, Mr. David Makhura, MEC for Health, Dr. Masuku, Professor Mativa, staff from the Chris Hani Baragwanath Hospital, many other distinguished guests, and members of the press. It is an honor to be here today to witness the first 20 ventilators of the first shipment of 50 of 1,000 ventilators that will be donated to South Africa. Through no small miracle, these ventilators were on the drawing board not 2 weeks before they arrived, when I telephoned the White House and explained to them the ground situation here. When President Trump made the commitment to send these ventilators to South Africa, the United States government, through the United States Agency for International Development, or USAID, arranged to have them arrive here in South Africa in a matter of days. The first country in the world to receive them. and the only country receiving 1,000. And how fitting it is that USAID has helmed this mission to provide the logistical and technical know-how, not only to guarantee that these American-made ventilators arrive safe and sound from the United States, but they shall be distributed and installed at intensive care units across South Africa. I want to take a few moments to explain why this event is happening today, amidst the developing situation in the United States, a situation that is causing my nation
The ambassador of the US there, Ambassador Lana, marks up on the podium in an event at the Baragwanath Hospital, not too far from where we are stationed here, where her, along with the Minister of Health, Dr Zweli Mkhize, and the MEC for Health in Gauteng, Dr Bandile Masuku, and the Premier of Gauteng, Mr. David Makhura, are acknowledging a gift of ventilators that has come through from the United States in the fight against COVID-19. We'll try and reconnect as soon as we're able to. But for now, let's take a break. You're watching The Agenda.
Investors were said to be looking forward to better economic performances as economies around the world
COVID-19 response. These ventilators represent the best of America, and may we always strive to be our best. Thank you.
Thank you very much, Ambassador Max, for the rich remarks. I'll move on to request our Premier of Gauteng to come and give words of appreciation. Premier David Makhura.
Thank you so much. The Minister of Health in our Republic, Dr. Zweli Mkhize, Ambassador Lana Marx, the Ambassador of the United States to South Africa, and back home, we really appreciate you are working for home as well, Ambassador. We appreciate that you were basically born here in South Africa and went to university here in Gauteng at Wits University. I would also like to acknowledge Dr. Joe Phaahla, our Deputy Minister for Health, the MEC for Health, Dr. Masuku. I also would like to acknowledge the USAID representative, Mr. John Broke, our CEO of Chris Hani Baragwanath, Dr. Lysia, and our distinguished Professor Matiba. The first thing I would like to say is that I am very grateful that this morning we are here at Chris Hani Baragwanath. This is a preeminent public health institution, not just in our country, not just in our province, but in the Southern Hemisphere. As has been said, it's the largest public hospital with 3,000 beds. I would like to first say, Dr. Matiba, that we will be adding another 500 beds. So if 3,000 is the largest in the Southern Hemisphere, there will be another 500 beds that are added. It's an important intervention we are making. Minister, we have some of our public hospitals where we are using alternative building technology to add additional beds, which will be required beyond COVID. So that when we are out of the pandemic, those additional beds will be utilized as additional infrastructure. Chris Hani Baragwanath has a huge burden. The patient load is huge. It is servicing not just the Soweto community, not just this part. It is part of the cluster that goes right into the Vaal. It is actually the anchor of the
It's not a very strong link we're having to that story today, and yet it's such an important story, and we'll continue making efforts there.
Someone who understands their circumstances, the challenges they face when they are going through difficult time, when they have anxieties, they are human, they have to care for patients, they have fears as well, they have families. Dr. Masuku understands all that, and he provides the best possible support. And when we have to make executive decisions as the Gauteng government, I've no doubt that we are acting on the best advice from him. So let me take this opportunity to thank all the healthcare workers who are here at Chris Hani Baragwanath as well today. You are the pride of our nation. When we deal with a pandemic, the most important people are you. If we are going to win this war, the people we're really counting on is you. And I want you to know that we deeply care about you. And when we lose any one of you, like we have lost 2 nurses already, it's something that affects us deeply. Thank you so much for the work you have been doing. Thank you so much to the US government. And thank you so much to the Field Marshal. Field Marshal, I know that you have your deputy always on your side here. Thank you so much to our doctors. I am proud to be led by doctors when it comes to healthcare in the Republic. Thank you so much.
Premier David Makhura, thank you very much for those words of wisdom. We'll move on with the program and request our Honorable Minister Zweli Mkhize to come and give us the speech.
Thank you very much. Please, may we take our seats. Thank you very much, Program Director. The Premier of Gauteng, Premier Makhura, Deputy Minister for Health, Dr. Joe Phaahla, Her Excellency the Ambassador of the United States of America in South Africa, Ambassador Lana Marx, the USAID Southern Africa Mission Director, John Kroek, and all other representatives of the USAID and
All right.
from the national. The CEO of Chris Hani Baragwanath, Dr. Alicia, and Prof. Rudo Lufuno Mativa, Head of Intensive Care Unit, other members of staff in Baragwanath, members of the community, members of the media, all the clinicians, the heads of department, and different professional categories, members of the media, friends, good morning to you all. Let me start where Ambassador started. First, I want to thank you for raising the issue of the tragic death of Mr. Floyd in the United States of America. His death is a dark mark in the history of mankind, particularly those of us who know the fight against racism and discrimination, and the sacrifices that many of our leaders, including President Nelson Mandela, Reverend Martin Luther King, and many others who fought for equality, who made us know that the only right thing to do is to stand up for our rights. It has been the saddest and most traumatic death that has taken place in the full glare of the public, wherein no explanation will ever suffice for the sheer brute force that the abuse of authority that it demonstrated and the anguish it caused, not only to the family, but particularly to the black community in the United States and black people all over the world who believe that this is nothing but naked racism. And in the process, it raises the sores of the many years of the brutalization of the black people over the years through slavery, through all sorts of other forms of discrimination and oppression. But I think we made a good point that we get these instances, as our President Cyril Ramaphosa, quite aptly commented, that whenever there's abuse of power in any country, including our own, that we need to stand up and object to such and make sure that we move society towards a situation where those become a history that we can talk about but not experience. And therefore, you would notice at this stage that people all over the world have stood up and said, Black Lives Matter, and enough of this kind of naked racism. And I'm glad to say that there are many American people who have stood on that side of the principle of freedom, of equality, of the respect for human rights. And I believe, therefore, that the pain of the loss, unfortunate loss of Mr. Floyd, really should act as a bond that unites humanity to never ever allow such abuse to ever happen. But thank you for raising it, because coming from yourselves, it's also one of those difficult questions that we must understand that whilst we have got an ideal of a future where there's equality, there's human rights, but that every day we're going to live with the imperfections of human beings. And therefore, working together, we need to really make a firm undertaking that we shall forever fight against such abuse, and that the flame of freedom, of democracy, of coexistence, human coexistence, and tolerance shall be the way that will define our future. So I want to thank you for raising it, and I do want to say that for all of us who have been traumatized by this, we can only find solace in the spirit of solidarity of all our people who will say, it cannot happen, not in our name. Thank you very much. Having said so, I also want to then pay tribute as well to yourself as a new ambassador. I've never had an opportunity to welcome you in a public event, but I need to do that because I've been highly impressed with the energy, the enthusiasm, and the vigor with which you have tackled your program. We've had several meetings wherein I've remarked about the fact that with you as a partner, representing the partnership between the two countries, there's a long distance for us to cover. And therefore, I've been very, very impressed. In this case, we have come to witness or to receive this great gesture of friendship, support and solidarity, which is a donation of the ventilators from the United States government through USAID, wherein we've received the 50 via ventilators LTV 2000S, which is at a market value of 486,000 rands per ventilator. The first 50 have been received. We're expecting 950 to come. You have made this your own undertaking, and I'm rather pleased that you have made it your own direct, deliverable. And so every now and again, I know you always give me updates as to how things are happening. This is a response to a conversation between President Trump and President Cyril Ramaphosa, where President Cyril Ramaphosa raised the issue to President Trump that there are various very important necessities that we need to deal with COVID-19 that have gone into short supply globally, and then did impress upon the President of the United States to always see where they can assist the African continent when such necessities are in short supply. So I was quite pleased to go and report back to President Ramaphosa that their conversation where this undertaking was made has actually borne fruit, and I'm sure we all recall that President Ramaphosa ultimately made a public acknowledgement of that donation. And therefore we are here to express our gratitude to the government of the United States for the contribution. We are also here to acknowledge the partnership that we have always had in various areas together with the United States government. This day would have happened 2 or 3 weeks earlier. However, because of clashing programs, we had to shift it up to this day. I want to thank MEC Dr Masuku, because he has had to run around trying to fit when is it likely to happen, and ultimately it has ultimately happened the way it has. And so when the batch of ventilators were to be received, we actually asked Professor Mativa, who's a member of the Ministerial Advisory Committee and one of the intensive specialists in the Ministerial Advisory Committee, to have a look and give us an advice. I was pleasantly surprised. Not only did she praise the make of the equipment, but she quickly decided that all of it shall be allocated to Baragwanath, Chris Hani Baragwanath. And by the time I went to consult the MEC, I realized that she had sympathies from the MEC as well. Now, this decision was taken to bring the ventilators into this hospital at the time, Premier, when the modelers had envisaged that the first peak that's going to get out of control on COVID-19 was going to be Gauteng, and then followed by KwaZulu-Natal, and thereafter, possibly later, Western Cape. Of course, I think we all are aware now that the models didn't quite get it right at the time, because now we've got to focus on the Western Cape as where the epicenter of the COVID-19 is. Therefore, the next batch that will be coming, let me make mode, which she will be explaining much more for us to understand. And by the way, I heard she was saying that you were saying that you were also trained by her, and you mentioned quite a number of them. I'm sure Baragwanath and Gauteng is very proud of having this baby born in this hospital, worked here, trained here, works here now. You've done well. Thank you very much, and thank you, Premier, for those very kind words, because I must say I get absolute cooperation from Dr. Masuku, and of course I have a wonderful team of MECs, and a whole lot of them very energetic and always on the spot, moving ahead to see what else they can do to serve our people. So he belongs to that crop which I'm very, very proud of. I don't always say this, I'm not sure I've ever said it, but I'm really very, very pleased and honored to serve with them. All of them much younger. I suppose somebody asked me whether I sleep is because I've got too many young people who keep me awake. He's one of those. But you were trained by Dr. Matima. Now, Professor Matima didn't train me, he trained you. But he trained with me. So if I may just make that clear, together with Dr. Phaahla, we actually shared the same class. That was many years ago. That's obviously long before you were born. So I want to therefore say, indeed, this hospital is, in fact, a historic monument. It's really one of the epicenters of clinical excellence in the country, both in terms of training and in terms of the clinical care. So I've got full confidence in what this hospital does and what it can do. But similarly, I really do want to pay tribute to the health workers in our country. They've done a remarkable work. And the fact that you can see the way that we're managing the COVID-19, it's really up to the dedication of the health workers in this country. And therefore, when we are today coming to make this contribution, we are saying we will do more to make it easy for them to execute their commitment of caring for our nation. And whatever that is needed, there are many other items that we are in short supply of. We were discussing the issue of protective personal protective equipment. We have made an undertaking that no health worker should be allowed to go into the front line and care for people who are possibly COVID-19 positive without being properly trained and properly equipped and protected. It's our undertaking that I'd like all the managers at hospitals, regional, district, and provincial and national level to always honor that all our staff needs to be protected. It's like taking your soldiers to a battle. You always make sure that they are protected, but they're well trained and they're well armed. And this we will want to undertake as we move on. And so, thank you for this contribution to arming our forces as they go to battle. It's a very, very important contribution. We are, as I was talking about some of the areas, are working hard to eliminate the backlog in testing, because as you look, we have done over 850,871 tests. That's a huge number, but nevertheless we do accept that it's still not enough. And from that point of view, we are actually continuing to source additional diagnostic kits so as to make sure that there is no hospital, there is no doctor, there is no nurse, there's no patient who feels that they are not able to get adequate care simply because they couldn't get the results from the COVID test. And therefore, we did indicate yesterday that we focus a lot on the Western Cape, and from where I see the backlog that they reported has actually been dropped. The latest of the figures that I monitor puts them at about 10,000. I know Gauteng is much higher, and KwaZulu-Natal, but I think we'll understand that we are now dealing with 2/3 of the caseload in the country, in the Western Cape. And of course, we look at the weight, the weight of the burden. It's not a provincial matter. There's only one campaign on COVID-19. That's led by President Cyril Ramaphosa. There is only one program. The plan that we're executing is the same every part of the country. And therefore, there's only one way of dealing with it. Everything is now the resources that are available for South Africa. So whether it's a public or private laboratory, it matters not. What matters is that that's where testing gets done. We've integrated everything in that way, and we're working very well at that level. When it comes to the shortage of beds, we have actually been pleased to see how, from Gauteng, we have moved all the way to create additional field beds. And I do know that with the current focus, we are now going to have to increase those beds. You've probably heard quite well President Ramaphosa talking yesterday. He said, very nice, thank you. So many beds that have been provided, but I want you to provide more. And I'm in complete agreement with that sentiment. We had already informed them that these numbers that we are seeing mean that they need to start commissioning new beds, so that by the end of the month, those beds are ready to come to stream. It's the same message I would like to send to you. More beds, because as well, from what we can see, we are still facing the storm ahead. And I think South Africans need to be aware that we have actually eased the restrictions and the lockdown. But that doesn't mean that COVID-19 has eased. It's actually worsened. And therefore, the impact thereof is going to be worse as we move on. And South Africans need to understand, it's no longer going to be about how much we can treat people in the hospital. It's about how much we can prevent more people getting infected so that they don't land in the hospital. If you come to the hospital, we're quite certain that our staff will do our best. And so the numbers that we're seeing have gone quite high. And at the moment, we're talking about numbers. The last record was 43,434, which is quite high. And as we've said, 66% of those are one province. Now, we need to learn something about that. Firstly, that the breakup did happen during the lockdown in the Western Cape, and therefore the cluster outbreaks that happened there are the ones that really went up to spread it into all sorts of different districts. Now that we are easing down the lockdown, the restrictions, we must expect that the numbers are going to start rising in more provinces than Western Cape, more than what we are seeing now. And therefore, the issue of behavioral change becomes the crux of the prevention. It is not going to be what the doctors and nurses and government can do. It is what each and every one of us as individuals are going to do. The WHO came out yesterday and was making a strong emphasis about the use of the fabric masks. And the point being that nobody must walk out and venture into the streets without wearing a mask, both to protect you from anyone who might be having the infection, although it's more effective as it protects others if you have the infection. And that is what has been proven scientifically. It becomes therefore very important for us to say to our people, let's not lose focus by fighting regulations. Let's really focus on what is it we can do to change behavior. The regulations were meant to just assist, to help people to get to the understanding that there are many things that we need to now forego because we're trying to protect each other. It was not because there was a sense of trying to control the lives of people. It is basically to try and create an environment wherein people understand that whilst you've got a right to enjoy yourselves, there may well be certain things which, whilst you're enjoying yourselves, could be endangering the lives of other people. And we were very, very appreciative of the decision that were taken by the religious leaders. And I can tell you now, if we think that these numbers are high, what we would have been able to get had all the churches, all the mosques, all the which one did I miss? Synagogue, that's the word I'm looking for, sorry. Thank you. And all the places of worship, and all the large weddings, and all the large funerals, if all of those things continued, we would be somewhere far away from where we are today. And therefore, we do want to continue to thank those religious leaders for going ahead and providing leadership to say, we shall hold all of this, all the prayers at home. And I like the statement they made. Turn your home into a church, turn your home into a mosque, turn your home into a synagogue. Your home must become a place of prayer. Even though government has said, well, we could open up at that level, it's really to say that there is no intention to restrict the freedom of anyone, but it's to be able to make a point that as you try to go back to a normal social life, there has to be a change. The change in behavior is what's going to save the country. And therefore, we don't want anyone to turn around and say, well, all these rules have been declared to be unconstitutional and irrational. Well, I think there's a technical issue there. When we've got time, we can sit and debate a number of those issues. And I think that where there are challenges, we need to learn from those and correct what needs to be corrected. But what we can't lose is that there's all the rational reasons for ensuring that people understand that there has to be a certain limitation on some of their day-to-day rights and activities, not so much because it's rights being taken away, but more because you need to protect each other. And that's really what we're trying to focus on. If there was a way of making people change behavior, needing no rules whatsoever, we would have opted for that one. Because then we would know that people are sufficiently empowered to be able to change conduct in such a way that there is no rule that is necessary. And of course, we must thank South Africans for the extent to which they were able to take up the message. If I stand here and look at how many of you are wearing masks, if I look back, if we were to talk about you wearing masks at the beginning of March, none of you would have thought we were serious about it. But to look at the amount of change that has happened, it's still not enough. We still need people to understand. So when we raise the issue of restricting gatherings and funerals, it's not so much because we think that the problem only arises from the body, a COVID-positive patient who might have died and is being buried. It is more the conduct of us as we support each other, comfort each other, and working, staying very closely, coughing and sneezing with all the body, fluids from our mouths and from our eyes, that poses the risk. And that's what we're trying to explain to everyone, to say, it's not because one wants to restrict how you bury your beloved. In fact, if you were to go to the Eastern Cape, the major source of common point contact that has been identified has been the funerals. Now, we did explain a number of things in relation to the funerals, and if you know people of South Africa and people in Africa in general, you really cannot say to anyone you can't go and bury anybody. It's the most sacrosanct kind of act of bidding farewell to your loved ones and to your relatives. So there's no government really who would want to go and interfere with such a sacrosanct ceremony. However, we need to send a warning to say we have already got records of people from what we see was Zwide in East London, where the first mixing happened, where the center of the first cluster of infectious cases were recorded from. These are concrete things. When we talk about churches, in the Free State, we're actually going through in a lot of resources to restrict movement of people and test a lot of people. And we did that because we had learned from the experience of Daegu in Korea, where in one church setting, patient number 31 generated so much of infection that a term was coined of a super spreader. And looking at how that church service had gone, it looked like something went wrong during the service, during this buffet, during the social settings that they had. That at a certain point, 60% of people who were positive were all traced to that particular occasion. It's not more about whether we want to restrict the freedom of worship. So I think we need to always understand this, because our biggest challenge is going to be how do we get our people to internalize the message of a change in behavior. A change in behavior that does not need to be based on the fear for the soldiers, for the army, for the law, for being imprisoned. A change of behavior that is going to be driven by the compassion that says that in case I might be having the infection and I'm not aware, I shouldn't infect the next person. A compassion that basically says it is common courtesy for all of us to talk about each other's behavior and say you should be wearing your mask so that in case anything happens, there's some degree of protection. Keep the distance, sanitize your hands, wash your hands. This is the kind of culture we need to now develop. If we are able to send such a message to the public, then certainly I think we would have been able to make an impact. And that, for me, is where the focus should be. Unfortunately, from the point of the principle of prevention to implementing and working together in the various other departments and the consultations and everyone having to raise their issues, then we have to end up arguing about alcohol, about tobacco. All those issues, for us, from the health point of view, there is nothing to recommend alcohol and tobacco for. Full stop. Everything else comes because South Africans, as society in general, always wants to raise issues about this right to enjoy this, right to trade on this, and so on. And that's how the issues become complicated. But if we were able to understand in the first instance, it was never about all of those issues. It was all about let's try and protect each other. So right now, we've done everything that we could. In particular, I've indicated the numbers of people that we've had to screen. About 15 million people. The screening is very important. But more than the fact that we could find out whether they are positive or negative, or whether they need to be tested or not, the engagement on the symptoms is an educational process itself that we believe it will be able to be replicated as people begin on their daily setting to talk about the symptoms of this thing. Now, 15 million people are talking about the symptoms. At least we've spoken to those, we know. The issue is you could have been screened, you can get infection soon thereafter, but now you'll be more alert because someone has spoken to you about it. So we believe, therefore, that those issues are quite important. It is of concern to us that the numbers of people who are losing their lives is increasing. And in fact, we were actually looking at the numbers that 70% of the deaths are actually coming from the Western Cape. When those numbers in the Western Cape stop increasing, it will not be because there will be less people getting infected and dying in the Western Cape. It will be because the other provinces are beginning to catch up, and therefore the leveling of the percentages. The numbers will increase unless we focus on the behavioral change. That is the aspect that we have to deal with. Interesting issues have been raised in terms of what is seen to be helpful. In particular, the question of the use of oxygen. Tigerberg, they've reported how a number of the patients that went onto oxygen early were actually saved from the infection. And Professor Matiba was telling us that their management here is superb. And I want to say we do need to pay tribute to you, Prof, for all the work that you and your team have done, but particularly the training of the many other intensive care specialists that our country has. We want to thank you for that, because at this point, we will need a lot more of those. We need to train more of those, and therefore, we need to actually make sure that even in small districts, there's adequate expertise to be able to cover at that level. So there's a fear or a concern about a possible shortage of oxygen in the future. We are working on that matter. We are going to be engaging the manufacturing companies so that we can see how we can ensure that the first cut in terms of additional oxygen that gets produced in the country and made available will actually be available to deal with all our patients. So all of those issues are for us very important issues, and we must also say, with our own health workers, we do wish to convey condolences to those of those members of staff who have lost, the members of the families that have lost members who are members of staff. At this point, in the last count, 2,084 of health workers have actually been infected and found to be COVID positive. That, as of, I think, the 1st of June, and of course 800 of those have recovered. And we have lost, at this point, 18 of those members of those health workers. As I said earlier, to us that's tragic. We will always do everything to make sure that we save the lives, not only of all our people, but also prioritize the health workers as well. So therefore, at this point, we do want to send a message that we are here to celebrate a partnership, because what has become clear is that the fight on COVID-19 is not going to be just a fight which is only about health professionals. It's the intersectoral response that is associated, it's the partners that we have, both from different governments and the multilateral institutions, WHO, which is actually our lead body that gives us all the guidance in terms of the protocols that we have to utilize. We want to indicate our confidence in the WHO and its leadership, particularly the Director General, Dr. Tedros Ghebreyesus, for the continuous support that they give to us. And in South Africa, for every province, we have got specialist expert teams that have got representatives from experts from WHO. So we want to express our gratitude to that. But in addition, in the country, it's an interdepartmental fight. The issues that have been raised about shortages of water, sanitation issues, the issues of housing, human settlements, there is a whole program now of detensification that's coming. The issues of the economic challenges that we have to face, we have to work together on all of those. These issues are very, very important. Right now, we're going through a whole challenge about education, whether the children should be going to school. And we're making a point that the children, we are saying we need to start opening up the schools. We're not saying that we want children to go there and get infected. We are saying this pandemic is going to be with us for a long time. We can't abandon schooling. We can't abandon, economic activities. We've got to slowly adjust with a new normal, a new reality of how you go to school with a mask as a kid, How do you go to school and be screened before you walk into the class? All of those issues were actually going to find lots of teething problems. But rather than fighting and criticizing each other, let's look at how we can help each other, how we can make it work better. Because at the end of the day, we are seeing that there are children who it might be possible to do e-learning from a distance, at home, but the bulk of the children in our country don't have adequate connectivity to even be able to think of, being part of e-learning. And even those where there might be connectivity, the levels of poverty are such that you'll not be having everybody having PCs available for those, for the tablets available for those children. So this is a problem of us having to try and work together. And I think as well, what we have seen is the various structures in society, civil society, business, everyone coming and getting involved. We were quoting an example of how working together in the Free State, we were able to actually hold the figures stable for a long time after a huge explosion. Mainly because it was government and the church and the community and everybody worked together. Which means that when we focus on identifying and testing, isolating and quarantine, that is still the mainstay of our strategy that works. As I was in the Western Cape in the wilderness area, I went into the Ceres Valley where all these orange juices and all the other come from. This town of Wittenberg, a small town, was able to show us that again this intersectoral, sectoral response is the way to go. So I'm saying we've got the formula already of how we can actually fight this infection. So we need to focus on where we can contribute and build this thing together. This very strong fight against COVID-19. Now with partners, such as what the United States of America has done in contributing. And of course, I do have to pay tribute for the support on the PEPFAR and other programs, which we believe are very, very important contributions. So on behalf of the ministry, myself and the Deputy Minister, the National Department of Health, and the Provincial Departments of Health and the Health Fraternity, we want to say thank you for this contribution, and we want to say thank you very much, Premier, for your leadership. I've heard you speak out there now, and I said, it sounds like you're really gunning for an honorary degree in medicine. The way your understanding of the issues is a very, very important issue, because at this point now, we want to hear the mayor, we want to hear the councillor, we want to hear the premier, the member of parliament, talking about COVID-19 as though they were the professional trained in it. The information has to be so general that everybody must use it on a day-to-day basis, that an NGO person, a church leader, must be able to give the correct message of what we need to do to fight this infection. If we can get to that point, we'll be very close to winning the battle. So this is the start. Case management is an important issue, but social behavioral change is the key. Thank you very much. Sorry, can I just say, please take your seats. I've got this mask. So I want to just say to Premier and Dr. Masuku, we have received a donation of these masks. And so we'd like you to share them with the staff, because we'd like everyone to use these masks. But in the workplace, then we reserve all of these specialized masks. But as we travel along, then we need to make sure that our members of staff, our government officials, our civil society, and our communities, they use other masks. So these masks will be useful because it can be kept for a whole year. Just wash it and change it and so on. So I'd like to hand over this donation to yourself. I'll give it to yourself and Premier, so that you will see how we can do it. It's 10,000 masks here.
Thank you. Thank you so much. We can just bring them back. Yes.
Minister, thank you very much again for the good words to this gathering. Also, that each time you talk in different platforms, you really encourage the action. Thank you very much for the huge outline that you made to make issues clear. I won't waste any more time. Instead, I'll call Deputy Minister of Health, Mr. Joe Phaahla, to come and give the vote of thanks.
Thank you very much, Program Director, for this opportunity to wrap up our very auspicious occasion. Let me pass my greetings to a colleague, Minister of Health, Dr Mkhize, our Premier, Honorable David Makhura, Excellency Ambassador, a daughter of South Africa, as said by the Premier, a very good friend of South Africa. Indeed, we are very pleased that the President of the USA chose you because you, as the Minister said, clearly you're very passionate about supporting this country, which also has contributed to your upbringing. Our colleague MEC for Health, Dr Masuku, the USAID Southern Africa Mission Director, Dr John Grog, CEO of Chris Hani Baragwanath Hospital, Dr Lucia, Prof Mativa, and all other staff members present of Chris Hani Baragwanath Hospital, our media colleagues, thank you very much for your presence, and we greet you. Mine is really just to acknowledge and thank everybody who has contributed to this very important function here. Indeed, I need to start with the person who made it possible for us to be here, Excellency Ambassador Lana Max, and the US team for your commitment in assisting us in this fight against the invisible enemy, the enemy of the globe, COVID-19. But we know also that while you're contributing to this, your country and yourself have been a pillar of strength in the broader fight against ill health and promotion of long life and good quality life for South Africans. We are indeed very grateful for this, the ventilators, the 1,000 commitment, the 50 which have arrived, and the 20 which we are witnessing here at Chris Hani Baragwanath today. Indeed, this will contribute immensely in making it possible for us to sustain our fight, as already mentioned by the Minister, the MEC, the Premier, that indeed where we are, we acknowledge that we are still in the early stages. We've been in this fight for some time now, from February, first patient on the 5th of March this year confirmed, and the numbers have been rising, and we're witnessing these numbers rising with the epicenter currently in the Western Cape, but being conscious, of course, that as the economy opens, as the Minister has just mentioned, that we are very cognizant of the fact that this is a marathon. It is not a sprint. It's a marathon. We're going to be in it for some time. We're just about, unfortunately, I've never been on the Comrades Marathon, but I know that people go up and down, and we're just on our way to the steep. And of course, as we witness what's the overwhelming nature of this pandemic in our Western Cape province currently, and as we see the numbers rising in Gauteng, in the northwest, especially where there is major economic activity, with especially looking currently with the mining industry clearly becoming, in terms of a particular industry, as one of those which are going to be a challenge, but we know that this can happen, as we have seen in the Western Cape, other clusters, even shopping centers, becoming clusters of explosion. So these equipments are indeed going to be very helpful in this battle. But also we are very grateful for your support, broader, as you have also mentioned, your support in this pandemic itself. It's broader than what has brought us here. We've been with you the other time we were together at the U.S. Embassy, where you're also contributing the N95 masks, which have already been distributed. So indeed, we want to say to the country that we indeed see the United States of America as a reliable partner in this fight, but also broadly in the PEPFAR side, very long-standing support, as you've mentioned, upwards of $80 billion over the many years in our fight against HIV and AIDS. And again, to say to those who worry that maybe as we focus on COVID-19, we're forgotten about HIV and AIDS and TB and non-communicable diseases, we want to say to them that is not the case. We still have our eyes focused in the broader fight against other diseases, and it's just that this is the emergency as declared by the World Health Organization in January this year, that it's an international emergency. So it's just that we have to make sure that we remain focused, and also to recognize the leadership of my colleague here, Minister Mkhize, as mentioned by the Premier, as well as a team with the MECs. Yesterday I was in the Free State with the Deputy President, and also the MEC for Free State did publicly acknowledge that she is very grateful for the support which they get as a province, and that we work together as a team. And to appreciate the leadership of Minister Mkhize, and led by our Commander-in-Chief, the President of the country, President Cyril Ramaphosa. We indeed, Premier, agree that we are in good hands. We are an army fighting this invisible enemy, but we don't feel in any way weakened, because we have very committed leadership, which is always on a daily basis giving us the direction. But I also want to thank you, Premier, and your team with MEC Masuku, that indeed, as Minister Mkhize mentioned earlier on, that in the early days, Gauteng was leading. And it made sense that Gauteng, as the mecca of our economy, the hub of the South African economy, but also the most populated province, with 15 million people out of the 57 million people in South Africa, that it made sense that with all the traveling at the time of mostly imported cases, that Gauteng would be looking at as the epicenter But through your leadership and the MEC and the team, you have actually managed to flatten the curve to the extent that, not that it's something which, we would say it's good that you've moved from number 1 and currently you are number 3. The Eastern Cape has already even overtaken you. So that means that there's something correct, something good happening in this province with all the challenges. So we want to encourage you and say that this is not going without notice by ourselves at the national level, but also I think from South Africans as a whole appreciate the leadership of Gauteng, and we nevertheless also are cognizant of the fact that going forward, as the economy is reopened, you face the biggest challenge, more than anywhere else in the country, with your population, with the extent of concentration of the economy here in Gauteng, opening of transport, opening of schools, opening of all sorts of industries, manufacturing and all that services. It means you are actually at the biggest risk. So as much as you are focusing now at the epicenter of the Western Cape currently, we are very at the back of the mind every time we worry and we want to see what's happening in Gauteng. And we can count on us to give you that support. Don't get. I know Prof. Mativa did express a concern that it looks like because of the nature of the challenge in the Western Cape, we're losing our focus instead of also looking at this very important area, which is Gauteng, with the biggest hospital in the southern hemisphere as Chris Hani Baragwanath and many other vital health facilities, Charlotte Maxeke, Steve Biko, and all those very important. We can assure you.
Well, Deputy Minister Phaahla, they're completing that morning session. The United States consignment that has come through to South Africa, specifically of ventilators, an event at the Baragwanath Hospital that was looked over, or rather the program was run by the MEC for Health in Gauteng, Dr Bandile Masuku, but the Health Minister, Dr Zweli Mkhize, was also there. So was the Premier of Gauteng, David Makhura. On to other stories now. And this is an important one for our viewers. Words like social distancing, containment zones, epicenters, isolation and quarantine are now part of our vocabulary. But what do they all mean? Are people using these terms the right way? Is it effective or needlessly scaring people? Also, understanding home hygiene helps you to clean smarter and to help to prevent the spread of the coronavirus. Now that restrictions have eased and people are out of their homes more, it's important to understand home and personal hygiene. To talk to us about this, we're joined via Zoom by Henry Muchauraya, Marketing Director, Home Care at Unilever, and Dr. Nandi Magudu-Mana, Founder and Chief Executive of Optimum Medical Solutions. A very good morning to both of you.
Very good morning, Desiree. Thank you for having us.
Morning. Thank you for having us.